looking for natural, alternative ways to treat and manage type 2 diabetes? Watch this video to learn how nutrition and natural remedies can help you prevent, treat, and reverse type 2 diabetes. Hi, welcome back. If you're new here, I'm Saroja. I'm a holistic health coach who's trained in nutrition and homeopathy. No one wants to hear that they are diabetic. If, however, you are among the millions of people across the globe who have been diagnosed with type 2 diabetes, then this video is for you. Evidence-based studies show that an effective treatment strategy for dealing with type 2 diabetes is to improve your lifestyle and eat healthy, nutritious food. This video will enable you to control diabetes more effectively by improving your metabolism and your blood glucose metabolism. Type 2 diabetes can be successfully controlled by a combination of healthy nutrition, exercise, and maintaining healthy weight and body mass index. For the best natural healthcare advice and tips, subscribe to my channel and hit the bell icon so you get notified every time I post a new video on a Friday. Let's get started. First, let's understand what is diabetes. Diabetes is a condition where pancreas can no longer process foods with high carbohydrates and high percentage of sugar. Diabetes is a chronic health condition in which our body cannot remove glucose from our blood effectively, especially after eating or drinking carbohydrates. This reduced ability to remove glucose and sugar from blood leads to a condition called hyperglycemia or elevated blood glucose level. Diabetes is also called insulin resistance. What is insulin? When we consume carbohydrates, our body breaks them into simpler forms of sugar called glucose. Glucose is then released into the bloodstream for immediate release as energy or for storage for future use. In order to store and use glucose, our body produces a hormone called insulin. This is manufactured or developed by beta cells in the pancreas. Beta cells also monitor the amount of blood sugar in our bloodstream to increase and decrease the production of insulin. Diabetes impacts this process and the ability of the body to produce insulin naturally. There are three types of diabetes: type 1, type 2, and gestational. Type 1 diabetes can happen at any age and is also called insulin-dependent diabetes. It is an autoimmune disease. This is mostly caused due to genetic reasons. Gestational diabetes typically develops during pregnancy and is easily manageable and goes away after childbirth. Type 2 diabetes is called diabetes mellitus. It normally impacts overweight individuals, especially during their old age. In type 2 diabetes, the pancreatic cells are unable to produce normal amounts of insulin. This condition is also called as insulin resistance. This form of diabetes can also be hereditary. What are the risk factors for type 2 diabetes? Some of the risk factors include being overweight, lack of exercise or physical activity, family history of diabetes, unhealthy diet, smoking, or high blood pressure. What are the early signs and symptoms of type 2 diabetes? Type 2 diabetes generally triggers after 40. The symptoms include excessive thirst, frequent urination, nausea, blurred vision, weight loss, slow wound healing, along with loss of muscle mass, tiredness, and hunger. What is a conventional treatment approach for type 2 diabetes? The treatment generally involves dietary and lifestyle modifications, incorporating moderate forms of exercise and eliminating unhealthy foods and sugar. Sometimes you may need to take diabetic medication. People suffering with type 2 diabetes are advised to keep check on their blood sugar levels in order to avoid complications. Some are even advised to take insulin injections. What are some of the factors that cause diabetes? Some of the factors are obesity, Being overweight or obese has been identified as a #1 risk factor for diabetes. In fact, 80% of the people diagnosed with type 2 diabetes are overweight. Cigarette smoking. Smoking increases the level of inflammation in the body. This increases the risk of diabetes in smokers as opposed to non-smokers. Smoking can also increase the blood glucose levels in your body and worsen the insulin resistance. Lack of physical activity is known to increase risk of diabetes. Saturated fats. Replacing your saturated fats with healthy fats such as avocados, nuts and olive oils can reduce your insulin resistance. Low fiber diet. A diet rich in fiber helps in decreasing the amount of insulin needed after a meal. Sugar sweetened beverages. Research shows that people who consume as low as 2 sugar sweetened beverages in a day have a 25% higher risk of developing type 2 diabetes. When you're trying to treat or reverse diabetes, your main focus should be to control your blood glucose levels, blood pressure levels, and keep a check on blood cholesterol levels. Here are some of the tips that can help you manage type 2 diabetes. Regular examination of blood glucose levels. You must also monitor your blood sugar levels closely since type 2 diabetes is a progressive condition. Please consult your healthcare provider on the frequency you need to check your blood glucose levels. Quality sleep. Reduced sleep or insomnia can result in hormone fluctuations, which in turn leads to high blood glucose levels. If you are suffering with sleep disorders or insomnia, watch this video to learn how nutrition and natural remedies can help you sleep better. Stress management. Physical or mental stress can aggravate diabetes. The degree at which stress impacts your blood glucose levels varies for each individual. Quit smoking. The reason for this is smoking narrows your blood vessels, elevates your blood glucose levels, and leads to inflammation. Regular exercise. Exercise not only helps in controlling and reversing diabetes, but also helps in burning fats and maintaining an optimum weight. Brisk walking, running, cycling, moderate aerobics are some of the recommended exercises that can elevate your heart rate and control diabetes. Dental care. The possibility of tooth decay is increased in people impacted with type 2 diabetes. This is because in diabetes, the blood sugar level not only rises in your bloodstream but also in your saliva. Since diabetes makes it difficult to fight infection, dealing with tooth decay can be extremely frustrating. Food care. Nerve damage is one of the most common complications of diabetes. The diabetic nutritional strategy. Diabetics do not need to go on a complex, strict diet plan. Their nutritional requirements are similar to any non-diabetic person. A diabetic meal plan includes a healthy, nutritious diet that is low in fat and low in processed carbohydrates. Here are some of the nutritional tips that you can include in your diet that will help you prevent, manage, and reverse diabetes. Number 1. Consume whole grains and lean proteins. Refined foods are lacking in all the great nutrition that is available in whole foods. Whole grains, on the other hand, contain all the nutrition your body needs to absorb naturally. Increasing daily consumption of whole grains can help reduce the risk of cancer, stroke, heart disease, along with managing diabetes and reversing it. Number 2. Consume unsaturated fats only. There are two kinds of fats. The good fats or the unsaturated fats are further classified as monosaturated fats. Olive oil is one of the most popular sources of unsaturated fats. And polysaturated fats, these are present in sunflower oil, soybean oil, and corn oil. The bad fats, which can be further broken down into saturated fats and trans fats. Some of the saturated fats are found in cheese, butter, ice cream, fatty meats, and palm oil. Some of the sources of trans fats are found in fried processed food and pre-packaged foods. Saturated fats can lead to heart disease, inflammation, diabetes, and even cancer. Trans fats are considered to be the most dangerous ones. The monosaturated fats reduce the level of bad cholesterol and elevate the levels of good cholesterol in your body. Omega-3 and omega-6 fatty acids are polysaturated fats that are extremely important to human body. Here are some of the sources of omega-3 fat. Consume one good source of omega-3 fatty acids. For vegetarians, you can consume walnuts, flax seeds, soybean oil, canola oil, eggs and flax oils. If you are a non-vegetarian, you can consume fish like wild-caught salmon, tuna, sardines or mackerels. Number 3. Eat more vegetables. The fiber in vegetables can bind to cholesterol and therefore facilitates flushing it out in the bloodstream. Try increasing your intake of vegetables by adding one extra serving every week. I will cover in detail the specific foods that you should eat and you should avoid in a new video. So if you want to be notified when I release the video, subscribe to my channel. Number 4. Eliminate prepackaged or processed foods. It is very important to eliminate refined carbohydrates, processed and prepackaged food from your diet. These are simply empty calories that lead to health problems including diabetes and obesity. Eat at regular intervals. Here are some of the tips that can help you ensure that you have a regular eating schedule. Never miss breakfast. For diabetics, breakfast is the most important meal of the day. A good, healthy, nourishing breakfast is recommended for balancing your blood sugar levels and maintaining energy. Eat regular small meals 6 times a day. Frequent eating ensures that you keep check of your portion size and also eliminates the risk of hypoglycemia. Work on your calorie intake. Avoid high-calorie foods and try to balance your calories throughout the day to maintain blood glucose levels. Eat slowly and stop when you are full. People who eat fast or in a rush always tend to overeat. Maintaining a food journal helps you keep track of what you eat. Multivitamin supplement. Metformin, a medicine used to treat diabetes, often interferes with the absorption of vitamin B12. Magnesium plays an important role in the regulation of blood sugar. A high dietary magnesium consumption is linked to lower fasting insulin concentration and hence reduced risk of developing diabetes. Vitamin D. Some of the physicians suggest vitamin D deficiency as a root cause of insulin resistance and diabetes. Food sources of vitamin D include fish, cheese, egg yolks and oysters. Sunlight is a great way to get vitamin D into your body. Omega-3 fatty acids. As discussed, omega-3 is very important in prevention and treatment of diabetes. If you are not consuming enough omega-3 fatty acids through foods, choose supplements that provide at least 600 mg or more of omega-3. Some recent studies show that intermittent fasting has been an effective way to treat and reverse diabetes. I will cover that in a new video. So if you want to be notified when I release the video, subscribe to my channel. As a disease, diabetes is not hard to manage. Following a healthy, nutritious diet and changing your lifestyle to include more activity and reducing your weight and your body mass index are great ways to help prevent, treat and reverse diabetes. I hope you can benefit from some of the nutritional advice and tips I shared in this video. If so, give it a thumbs up. Share it with your friends and family who might be suffering from type 2 diabetes or looking for ways to prevent it. Subscribe to my channel so you get notified every time I post a new video. Please remember, before making any changes to your medication or diet, you need to consult with your doctor and take their advice. If you have a type 2 diabetes related question, comment below and let me know and I will try to answer it or cover it in one of my future videos. Thanks for watching. Until next time, stay healthy.